Welcome back to It's Personal. It's Personal is brought to you by Gunderson Health System. I'm Chris Stauffer. The CDC is out with some new information about HIV. They're finding that HIV is hiding, that many who have it aren't doing much about it, not managing it, but HIV infection rates are steady. Joining us to talk a little bit more about what we found in this study from the CDC is Megan Meller. She's an infection preventionist in infection control at Gunderson Health System. Thanks for being here.
Thanks for having me, Chris.
So what are we finding in the study? I think, off the top, we're learning that HIV is in some ways hiding in some infected individuals. What are we learning about that? What does that mean?
So HIV can remain, when you're infected, you might not be expressing any symptoms. And so it's at that point where it's really easy to spread it to sexual partners or to even spread it vertically through childbirth. Luckily, we have a lot of really good programs in the United States to screen women during prenatal care to make sure that we're catching those cases. But there's still other vulnerable populations or at-risk populations that we're not catching. And what this study is showing is that there is still a lot of, while we've gone strides, we've gone far in really reducing the mortality associated with HIV. That is reducing the onset of AIDS and, any other factors that might come with it. We're not doing enough to diagnose and treat earlier, and even to do, with preventative medication. We're not getting that out earlier to even, prevent the development of, prevent the infection of HIV.
It seems surprising to me, and maybe I'm, just naive in this, but it seems surprising to me that many wouldn't know that they have HIV. Aren't there strong signs and symptoms of the HIV virus that many individuals would be, experiencing?
Not necessarily, not until it becomes a little bit more advanced, and then you start developing some immunocompromising conditions. So you're getting sick more often, which is then AIDS. So basically, it's an immunocompromised condition brought on by HIV. But there are at-risk populations. So generally, we think of those the men who have sex with men population, or inner city populations too, where they're going to be more at risk and they don't have the greatest access to resources. And so it's really getting contraceptive, we think contraceptive care, but, getting, condoms out there, or just even doing that education about, this is what your risk is, and then getting those vulnerable populations on preventative medication, so what we call PrEP. So it's an antiviral that would prevent the virus from latching onto the body after an exposure. So it's an incredibly powerful drug that we have at our disposals. And there's a lot of, the study is showing, we still have a ways to go in making sure that that's getting to the populations that it needs to get to.
So let's talk a little bit about that, because that's one of the other findings in the study is that managing, for those who are aware that they have HIV, they're not necessarily managing it. Does this go back to the access to health care and the access to resources, or is this a broader discussion?
I think it's kind of what you just hit on. It's really it's a public health concern. It's an access to resources. So with HIV, there is no known cure that I'm aware of. But there are a lot of really great treatments out there that can, what we call, reduce viral load. So one of the common tests for HIV after diagnosis is, we call it PCR. So what you're essentially looking for is you're looking for the virus within the body. Okay. And if you can detect the virus in the body, it suggests, we still need to do some treatments, to really kind of keep that under control and to keep the immune system healthy. But for many people, we are able to keep viral replication down, so we can't even detect it with our tests. So again, while that doesn't mean you're cured, it means it's not causing you any harm. It's just, it's just lying there dormant. And so that's where really we made a lot of huge strides in preventing the mortality, from, eventual onset of AIDS. It's because we have these great medications, but it comes down to access and also to follow up, making sure that you're seeing your healthcare provider on a regular basis. The state of Wisconsin has a lot of really great resources. So, for people who have been diagnosed with HIV. So one of the things, a unique thing I always like to share from the infection prevention side is we have to report certain cases to the state health department. Mm-hmm. HIV is one of those, when we have a patient comes in who's been newly diagnosed with HIV, we place a phone call to someone, an epidemiologist at the state health department, and they get all the patient, they gather all the patient information. And then what they do from there is they make sure that patient has every single resource that they need, setting them up with a case manager, a social worker, getting them connected to the AIDS Resource Center of Wisconsin, making sure that they have that support network and that they're getting the medications that they need to live a healthy and fulfilling life.
So the key thing, it sounds like you're saying, is that once they become aware, we can do something about it. We can
Absolutely.
really help that individual, not only with a lot of resources, but certainly extend their life.
For sure. And I don't think Wisconsin is alone in this. I think a lot of other states have these resources and have these programs. And I think especially having those case managers are really important because people can fall through the cracks, for various reasons, or fall through like the medical cracks, and then, it's hard to get them back into, a consistent line of care. And so by having those case managers who can really develop close personal relationship with these patients, I think it can really offer a lot of support at a time after diagnosis, which could seem very daunting.
Yeah.
So, there's things out there, but that also doesn't cover the group of people who are vulnerable to begin with. So those, who could use some PrEP. And so there's a lot of work being done too in like inner cities, so like Milwaukee, Chicago especially, to to really reach out to those populations, those underserved, low socioeconomic status populations who they might feel that they can't relate to their provider, but then you bring in someone else who can relate to them and who can say, there's nothing shameful about this. We need to do this to protect you. And so there's a lot of discussion, and a lot of change that's happening that's really exciting.
We're talking with Megan Meller. She's an infection preventionist in infection control at Gunderson Health System about the Centers for Disease Control, the CDC, and some new information that they just provided in a study that is done on HIV. One of the things that I found, I don't know if it's good news or if it's bad news, that information is that HIV rates are steady. Mm-hmm. So the number of infections with HIV are somewhere around 38,000 individuals annually. Mm-hmm. And that rate is pretty steady from year to year. So the good news is that it's not going up.
Right.
The bad news is that it's not going down.
And I think that's where getting that preventative treatment in is really critical, and that education to those at-risk groups.
And do you think that that's something, that's one of the reasons that the CDC is really trying to lower those rates?
Absolutely.
Yeah.
I mean, public health is all about looking, at your vulnerable populations. And so, yes, it's great that we're not seeing an increase, but there's a lot that we can do to start bringing those numbers down to prevent new cases from even happening in the first place.
Let's talk more about those solutions, because that's one of the things that the CDC put out is some potential solutions, and maybe you want to share some of those things, because I think we as a society would like to hear some of those potentials, because we can potentially make a difference.
So I think really the biggest thing that we can say is letting patients know that there's treatment available. So it's providers having really open conversations with their patients who might be at risk. Again, this is largely going to be the men who have sex with men population, but it's not just limited to them. It can be spread through heterosexual relationships as well. But it's all, it's if you're at risk, go get tested. In general, we're always preaching, don't be ashamed about STD testing, because there's a lot you can do from prevention, from knowing your partner's status and your own status, and then from going forward. HIV is the same thing, So I think providers are getting really good at asking patients if they would like to be tested for HIV, and kind of, getting that diagnosis sooner rather than later. But that's still not stop, reducing the number of cases. And that's, I think, so the new cases are, we have some really good, screening tools that we can employ to get patients treated sooner rather than later. But again, it's working, with the homeless populations. It's working with, inner city populations to, get the message out, make PrEP more available, and really get them connected to resources. I believe PrEP is very cost effective, if not free, to certain populations, because they're trying to increase the use of it.
And I think it could probably be argued that this isn't just an HIV discussion. This is in other areas of healthcare that trying to get to some of the populations that are, I'll say, underserved when it comes to healthcare would make a big difference in some of these numbers and some of these fatalities.
Because it's HIV is bloodborne, so it could be sharing needles. So that's where we also talk about the risk of like hepatitis, hepatitis A and hepatitis B and C, because it's so hepatitis A is not spreading really through needles, but but B and C can be, and so it's that awareness of like single use needles, don't share, wash your hands and get vaccinated, and or get the appropriate treatment before any exposure. And it's a really challenging aspect of public health, but it's also a very rewarding one when you see it work, and when you see people relating to others, from different backgrounds in order to improve their quality of life and give them a chance.
I don't want to put you on the spot, but I'm going to put you on the spot. Throw out your crystal ball here, or pull it out, and tell me where we're going to go. Where's this going to be in 5 or 10 years? Do you think we're going to continue to see rates at a steady rate of 38,000 individuals per year, or do you think that by getting this information out, the Centers for Disease Control is going to make a dent?
I'd love to see this make a dent. I think, especially if it could open up funding. Money is always, I think, at the top of this, because public health, you need money to do public health, and so I think by opening up funding, there's going to be a lot of like small studies and small and work being done, especially in those community health clinics, because that's where you're going to largely see people who are coming, or patients coming in who may not have insurance. And so it's reaching out to those. And so I know of some people who are working in inner city Milwaukee who have where this work has really resonated with them.
Yeah, very interesting. All right, Megan Meller, infection preventionist, Gunderson Health System. Thanks for being here.
Thanks for having me.